So good afternoon, ladies and gentlemen. My name is Zahra Momenzadeh, and I'm from Iran, but I come from Hungary, Pécs, and I'm a fifth-year medical student. And today I'd like to present telemedicine and specifically TeleVisit, which is an application launched by ITA, Iranian Telemedicine Association. And I'd like to just briefly talk about this with you today. Which, by the way, this is the logo of the application. So, what is telemedicine? Telemedicine basically refers when you try to use the technologies and you try to use the telecommunication to either give or receive any health-related services. And that's how we normally define telemedicine. And what it offers is telementoring, telemonitoring, telesurgery, and of course, I think most of us have already experienced televisiting because of the Corona era, and that made a lot of us to get used to telemedicine because there were just doctors through things that, Zoom that we could meet with. What are the advantages of telemedicine? Of course, it's time efficient and cost efficient. For example, in Tehran, it's a very big city. You can't just afford 2 hours to sit in the car and go to the doctor and come back. And patient selection, I would like to point it out because patient selection is important. Not every patient has to go to the doctor right away, and this way you can screen them. And legislations are always a question because you don't know what are the rules you have to follow unless you start and launch the program. And in medicine, we face a lot of private stuff. You can't joke with that. You have to keep the privacy of the patient always. And so what TeleVisit application, for example, offers is that it takes away the limitation of time and also the place that you are. So doctors and patients can get in touch with each other easier. And who can use TeleVisit? Literally anyone who has access to a smartphone, the application and internet can be the patient, and any doctor who is a certified doctor can use this as the doctor. Of course, it's very simplified because I only have 6 minutes, but that's the short story. So in the review study that we had, and it was done by ITA, Iranian Telemedicine Association, we were trying to see if this motto will work. And the motto is, can we say use televisiting before going to the doctor? So that was the question. And so we mostly worked on non-urgent patients, not the urgent ones, because it was more logical to go first through this group of patients. And the way they had to do was that they had to upload their documents, including their lab results, their, radiology results, anything that they wish to share with their doctor. They could even take a picture from their skin and just ask for some dermatological questions. And then the doctor would go through these documentation. And then if it was needed for further, examinations, they would say it, or if just prescription. And I think most of us are already informed and know about the cloud system. Because there's this virtual space and the doctor will upload stuff and then the patients will just go to the pharmacy and they will just receive the medication, for example, or even to radiologists. And this is an important point. Of course, at the end of the day, there are patients that they have to just right away go to the doctor and you can't, ignore this aspect of medicine. So the conclusion was that actually, specifically non-urgent patients, it's worth it to try the televisiting first and then go and see the doctor in person. Of course, in the related field. And also, I would like to point this out about telemedicine. I think it's really important that there are, for example, in Hungary, there are a lot of Persian people, and they really wish to talk to their own language, they wish to talk to a Persian doctor. Why? Because when you have a doctor from your own culture, you don't have to explain the whole cultural background to the doctor, and I think that's something that not every patient wish to have the same doctor as the same nationality, but there are a good bunch of patients like that. And it can be a good way to use telemedicine. And what Iranian Telemedicine Association is planning is to increase, because TeleVisit is actually launched already in Iran, and we're planning to increase this, the scale, and to have more communication with the world. And by the time I'm talking about this right now, today there is going to be a meeting between ITA and the Sultan Qaboos University, how we can actually communicate and we can go through further steps about telemedicine. What else? Of course, it's efficient. Telemedicine, that was the conclusion I already mentioned. Acknowledgements. These were the institutes we worked with through our study, and this is basically, I think, the most important slide I want to present. Everything, every big goal and every big dream takes a good team. For example, for telemedicine, we need educated patients, we need educated doctors, we need good radiologists that they know how to use the devices, how to upload things in, and also like legislation. So everyone matters in a team, and that's very important, I think. Thank you for your attention, and if you have any questions, please let me know, and if you don't have time, then after that. And I would like to thank my friends. They supported me so much through this, so that's just thank you.
Question. I have one, if you don't mind.
Sorry?
I have a question.
Yes, sure.
So it's quite interesting, this telemedicine aspect. And so you mentioned this cross-country telemedicine. So like you're in a country and you're doing a teleconsultation with a doctor from another country. How easy is it to do that in practice? Because you might have like social security differences between countries or different medicines. So how do you do that?
That's a very good question, because that's basically the most difficult thing we're dealing with right now. And that's why, like, I think the best way to just solve it is go step by step. And actually, I think it's more smart to start with the cultures that are close to your country. And that's what we're trying. That's why, like, Oman and Iran, they're kind of close. They're kind, and that's how you can go further with your planning. Because I've seen this throughout our whole process. That if now in Iran you want to just communicate, let's say with, I don't know, somewhere in Africa, for example, or somewhere that's a bit distant, it's harder to communicate, but I think the smart way is to just go step by step. But it's actually very difficult, and I really don't, we just have to go through it step by step. Thank you for the question.
Thank you. And the last speaker of this session